All right, well, let's start then. I want to make sure that everybody has a chance to give the high points of what they learned through this process. So why don't we have the first group on absenteeism report in? Come, please. Yeah, just the high points of what.
Okay. All right, so my group was tasked with the education, and we were kind of, so the focus was on absenteeism. There's a school that has a high rate of absenteeism, and so that was our problem that we were tackling. And so I'll invite my group members to jump in if I miss anything and to fill in some gaps. But we thought about the convener as being the school, and while recognizing that there's already a lot put on the schools, and in our scenario, the schools didn't want to jump in, but kind of thinking of them as the convener without the pressure of having to also be the funders. So we thought they would be a good convener because it's kind of a metric that kind of speaks to their quality. So conveners without being funders. We mentioned several partners to include employers, banks, legislators, school resource officers, student attendance support staff, public housing providers. We also talked about coaches for the sports teams at the schools, local government, and I don't know if I missed any. Did we talk about any others? Good. Okay. And so then for our general approach, we talked about, we really tried to stay upstream. And as we were talking about our ideas, we came up with this has been out there already, but a multi-generation approach. So not just focusing on the students, but focusing on supporting parents or caregivers or whoever it is that, has responsibility for that child. Because if a parent or caregiver is feeling supported, they're more likely to be able to support their child as well. And in the limited time that we had, we came up with a couple of strategies that were based really in experience from some of our group members. And so one of those was having a community bank stepping up as an investor of a pilot within one of the schools that would kind of fund a convening, fund the space, and perhaps time of people to convene. And the convening would consist of all the partners that we mentioned, but also focus groups to kind of learn from the community where are the levers that we could kind of push to help relieve some of the challenges with absenteeism. And then the bank would also function as a sort of recruiter to say, look what we're doing for our community. This is how it's helped us in getting other employers, other banks and other communities for other schools involved as well. And then the second strategy was, basically getting, part of our scenario was having the county executive to call for this as a priority. And we really agreed that that should definitely be a strategy because unless leadership is bought in, as we all know, it's likely never going to happen. So I think that's it in a nutshell. I don't know if anyone from my group wants to chime in on that. Okay, good. So that was it for us.
Did you have any particular?
We did have a little bit of a conversation about thinking about school staff and tapping into skills that they already have that aren't necessarily being supported and implementing in the schools. And so one of the examples that we talked about was when you think about the bullying intervention, it's not about adding more people or more staff, but kind of empowering the bystanders to use the skills that they have within themselves to make a difference. So that sort of approach in working with the workforce.
You don't need new money at the moment.
No.
Okay. And how about somebody to come and talk about affordable housing?
So our group talked about affordable housing and the scenario in which we're experiencing high rates of displacement in our community and people who are very much rent burdened. And the question is, whose job is it to address housing? And so some of the partners that we had at the table were the housing authority, the local government housing authority, a healthcare institution, philanthropy, a federal agent, and a state community-based organization, community-oriented organization, and advocacy group. We had a faith representative, and we also had some folks from academia. So in thinking about who the best conveners would be of a coalition of those folks, we decided that it would not be the best thing to address this complex issue of affordable housing, which is a lot of pressure from developers from the private market, as well as the interests of a very vulnerable group of people who are either rent burdened, on the verge of being homeless, or are homeless. So we decided that the best convener for such a topic to be more independent would be a local philanthropic group, like a community foundation, or a faith group who could really speak to the interests of those folks most at risk. So we were struggling, honestly, with how to take a workforce approach to this, because of course our minds went to policy and what state policies, local policies can we change to address this very quickly fast moving development problem that we're having in our community. So the health system has some resources. They don't want to just give grants to build housing. But in thinking about some of the capacities that we need to have among the different workforces of these different types of organizations is better awareness of the financial process and the financial forces that are at play when it comes to housing development and essentially the market. Thinking about how to bring more of a social determinants lens to current staff at the housing authority, in the hospital system. They see it as like as a if-then kind of thing, I think, where we know housing is a problem because we see it in the healthcare, in who we're serving. So there definitely is an interest there in expanding awareness, as well as I thought it was really good to bring up that if your staff can't afford to live where they work, then you're not going to have good staff satisfaction or you're going to have high turnover. So having affordable housing is actually really important, not just for people who we're concerned about who are almost homeless, but also just our staff. So am I missing anything? We really didn't, unfortunately, land on this is a very clear workforce strategy to address this challenge, because it's so multifaceted. I think, just kind of broadening everyone's lens and having increasing, maybe a multi-sector approach is the best approach, is basically where we landed, where we have, thinking about having an epi person work for the housing authority so that they can crunch numbers on the connections between social determinants of health and health outcomes, et cetera. So anything to add from the team? Okay.
And the food insecurity group, please.
Good afternoon. Michael Ryan with Institute for Public Health Innovation. For the first 7/8 of our session, we all wondered if we needed collaborative, rapid problem-solving training, and but we pulled it together at the end, so we're very excited about that. We thought it would be our vignette really involved a town that was experiencing food security issues, and they were pulling the group together to develop a comprehensive food security plan. And so in this case, and this is a model that we've used at IPHI, where a public health institute is the backbone entity for a non-incorporated multi-sectoral coalition, and we named it the Food Equity Council. And this group already has a lot of different sectors at the table, And we thought it would be helpful to identify those public health interventions that we would be focused on and think about the workforce that would be behind those interventions. We started with two. The first, which was hinted at in our vignette, was to work with the school administrators to adopt the community eligibility provision of Title I. And in this case, to do that, we thought that there would need to be an advocacy training component particularly for perhaps parents and teachers and community members. We thought there would need to be some education and training across public health, community, the school community groups, and education administrators to really understand the importance of the issue and then how to go about the administrative process of adopting the provision. And then there would need to be kind of training around the implementation of it across the school district, as well as a communications campaign for the workers in the school system. A second strategy that we talked about was it was hinted at there was a loss of an important grocery store in the neighborhood, and so we wanted to embark on a campaign to bring a full-service grocery store back to the neighborhood. And we thought that there would be a number of workforces involved: the traditional public health governmental workforce, planners, the economic development sector, community members. And so for this as well, there would be some advocacy training. We thought community health workers, community residents could play a role in organizing and advocating for the return of a grocery store. And so we could provide some workforce development and training to support them to play that role. Pursuing grocery store financing would require some training on the part of the different, particularly public health, and who might be new to that kind of work, and the economic development sector could maybe be a leading workforce in making this happen, but they would need to be kind of brought along to appreciate the role of food availability and ensuring prosperous communities. So I don't know, did I miss anything? My group? Okay, thanks.
Did you talk about who was going to pay for any of this? For the advocacy training? You didn't get to that. That's fine. And we have one more group to talk about absenteeism. And I'm not sure who's going to report.
Well, we were the second education group looking at absenteeism. I'm Lisa Kaplowitz, by the way. I'm a physician. I've worked in a medical center. I've done state, local, and federal public health. I'm moving back to local, which is really where I want to be. So this has been a great transition for me since I start my new job April 1st. We spent a lot of time talking about all the reasons for absenteeism, and this brought a lot of people to the table. We talked about community violence, and that brought law enforcement. We talked about homelessness, and that brought a lot of people to the table, including shelters, bringing parents to the table, school nurses to help us identify what's really going on, really focusing on what the problems are, medical issues. Do we have a lot of absenteeism due to asthma? We need to bring the medical community to the table as well. And we need to really improve communications among a range of diverse community groups. So this is really a very diverse problem, and focusing initially on what the initial problems are. We had a lot of people, as I said, at the table looking at the different issues, and we did want to bring community health workers into this, educating them in terms of what the issues are and who would the community trust. Do we want to send people into homes to really address specific issues? Is this the way to really engage parents and to bring the students into school? So we were all over the place, but clearly involved the entire community. Oh, the key business was very concerned because school absenteeism was keeping their employees home. And this was a major concern, and we were ready to get support from one of the key businesses in town. And could we turn to the hospital for community benefit, because this was not helping them, having all these students show up in their emergency room for asthma care. So we didn't have any solutions, but we brought a lot of people to the table, and I think we really could use community health workers to help us reach into individual homes and communities. Okay, did I miss anything there? Thank you.
I also mentioned, because this groceries are concerned for the food, essentials, etc., we would like to have a business roundtable. This was from my past experience to discuss this. And when you deal with a school health nurse and you're asking her or him, whatever, to do extra work that involves the labor unions, it would be nice to have their participation. Thank you.
Great, thank you. Well, thank you all for thinking about this. I see that it's challenging to get to the next step of who we need to train to do what. I think we had a sort of short period of time to talk about this, but hopefully people will be able to mingle some of the ideas that they've heard today and thinking about solutions to workforce training issues in their communities. So I think without further ado, I'm turning it, is it to you, Sandy? Do you come next? I'm not, Josh.